Thank you for coming today for the launch of the Doctors Protecting Children Declaration. My name is Dr. Jill Simons. I'm a board-certified pediatrician and the executive director for the American College of Pediatricians. Today, I'm here alongside my colleagues representing the coalition of co-signers of the Doctors Protecting Children Declaration. Our coalition consists of physicians, together with nurses, behavioral health clinicians, other health professionals, scientists, researchers, and public health and policy professionals. And we have serious concerns about the physical and mental health effects of the current protocols promoted for the care of children and adolescents in the United States who express discomfort with their biological sex. This declaration was authored by the American College of Pediatricians, but really it was developed from the expertise of hundreds of doctors, researchers, and other healthcare workers and leaders who, for years, have been sounding the alarm on the harmful protocols that continue to be promoted by the medical organizations in the United States. Despite recent revelations from the leaked WPATH files and the recent release of the final report from the CAS review, these medical organizations have not changed course. So we are calling on these medical organizations of the United States, including the American Academy of Pediatrics, the Endocrine Society, the Pediatric Endocrine Society, the American Medical Association, the American Psychological Association, and the American Academy of Child and Adolescent Psychiatry to follow the science and their European colleagues and immediately stop the promotion of social affirmation, puberty blockers, cross-sex hormones, and surgeries for children and adolescents who experience distress over their biological sex. In our declaration, we affirm that sex is a dimorphic, innate trait defined in relation to an organism's biological role in reproduction, male and female. This genetic signature is present in every nucleated somatic cell in the body and is not altered by drugs or surgical interventions. Consideration of these innate differences is critical to the practice of good medicine and to the development of sound policy for children and adults alike. Medical decision-making should be based upon an individual's biological sex. It should respect biological reality and the dignity of the person by compassionately addressing the whole person. We are here defying the claims made by these medical organizations in the US that those of us who are concerned are a minority and that their protocols are consensus. They are not consensus, and we are speaking in a loud, unified voice, enough. We also encourage the physicians who are members of these professional organizations to contact their leadership and urge them to adhere to the evidence-based research now available. This declaration is live on the website, doctorsprotectingchildren.org. Please read it. You can see the impressive coalition of co-signers already on there, and you can sign. I'm now going to turn it over to each of my colleagues standing here with me to introduce themselves and say a few words about the declaration. Note that these courageous leaders represent thousands of doctors and healthcare workers within their organization. Thank you. Dr. Van Mol.
Good morning. I'm Dr. Andre Van Mol. I'm a board-certified family physician. I'm here today representing the Christian Medical and Dental Associations, American College of Pediatricians, and the American Academy of Medical Ethics. Briefly, gender dysphoria is a diagnosis, whereas transgenderism is an ideology. The natural course of gender dysphoria is desistance by adulthood, conservatively in 85% of the cases, unless it is affirmed. Gender dysphoria carries with it the overwhelming probability of underlying mental health issues, adverse family dynamics, adverse childhood experiences, and autism spectrum disorder that usually predate the gender dysphoria itself. The probability of both desistance and underlying mental health and other issues is why watchful waiting, coupled with mental health evaluation and counseling for both patient and family, was once and is increasingly again recognized as the standard of care for minors with gender dysphoria. Systematic literature reviews done in the United Kingdom, Sweden, Finland, and Germany show that so-called gender-affirming healthcare is out of step with the evidence base for gender dysphoric youth. Transition affirmation is not proven to be safe or effective long term. It does not reduce suicides. It does not repair mental health issues or trauma. Minors cannot give truly informed consent. Children have developing and immature brains. Their minds change often. They are prone to risk-taking. They are vulnerable to peer pressure, and they don't grasp long-term consequences. Refusing to provide gender transition procedures, or so-called gender-affirming healthcare, is non-discriminatory and is appropriate both professionally and scientifically. Withholding unproven interventions is non-discriminatory, and gender-affirming healthcare has neither been shown to be safe nor effective nor of more help than harm. Physicians take an oath to do no harm, and gender-affirming healthcare is documented to lead to harm. There are good mental health alternatives to gender-affirming healthcare, which address underlying issues rather than dodging them. Finally, there is always a more honest way to deal with gender confusion than the chemical sterilization and surgical mutilation of healthy young bodies. I thank you for your kind attention.
Hello, my name is Dr. Carl Benzio. I'm a board-certified psychiatrist. I represent Honey Lake Clinic, a residential treatment facility, American Academy of Medical Ethics, and American Association of Christian Counselors, and the Christian Medical and Dental Association. The great philosopher Voltaire warned, "When people believe absurdities, they will commit atrocities." Directing adolescent programs is one of my specialties. We always knew gender confusion, dysphoria, dissonance, and evasion was a manifestation of deeper psychological struggles. These struggles usually emanate from dysfunctional or misinterpreted relational dynamics with parents, siblings, and peers, from being victims of abuse or early sexualization as minors, or having compromised social skills, as in autism or developmental disorders. For many, these struggles resolved when puberty hit. But for those that didn't, or other cases where significant disruption, distress, or obsessing occurred, the standard of care was psychological or psychiatric evaluation to diagnose the underlying psychiatric issues, followed by individual and usually family therapy, often for at least 9 to 18 months. This treatment was delivered by trained, licensed psychotherapists and psychiatrists, as we have expertise in helping patients remedy the internal unconscious struggles which precipitate their gender confusion. Psychiatric evaluation and care is paramount and necessary because gender confusion is not a biological issue. It is a psychological one. After implementing GAT, various countries have realized GAT not only ignores the underlying psychological issues, but it also inflicts a host of new ones. Sadly, these problems are compounded by the psychological and physical damage that social, chemical, and surgical transitioning causes. England, Finland, Denmark, and Sweden are reversing their GAT positions and advocating for the more successful standard of care, which is psychiatric evaluation and treatment. As a healthcare professional, I'm saddened by the ongoing suffering caused by GAT. I desire for all children to find healing. Please join us in stopping the belief in absurd GAT policies and malpractice, and let's get back to gender confusion treatment standards based on sound science, common sense, and the truth, so we can protect kids from atrocities inflicted on their mind, body, and spirit.
Good morning. I'm Dr. Erica LeBaron. I'm a board-certified family physician, and I'm the president-elect of the Association of American Physicians and Surgeons. We were founded in 1943 as a physician organization that represents independent physicians, and we have members in virtually every state and almost every medical specialty. We are devoted to the practice of medicine in the tradition of Hippocrates. Unfortunately, the protocols currently being pushed on children and adolescents violate the fundamental precepts of Hippocratic medicine, which is to prescribe regimen for the good of the patient and ultimately to do no harm. It is my honor to be here today to express the utmost support from the Association of American Physicians and Surgeons to this coalition in its declaration to protect children. It's past time for our profession to end harm being done and instead provide care to children that is both rooted in science and principles of medical ethics that put patients, not political ideology, first. Thank you for the opportunity to be here today to stand with my colleagues and support this crucial mission. Thank you.
My name is Dr. David Olson. I'm a private practice pediatrician, and High Point, North Carolina. I'm also a member of the board of the American College of Pediatricians. I'm here to enthusiastically support this declaration today, and I urge all of my colleagues, regardless of your medical specialty, everywhere, to read the declaration, read the references, and then to make a careful decision and sign on. The time to act is now. Thank you.
I'm Mario Dickerson, Executive Director of the Catholic Medical Association. We represent thousands of physicians, nurses, and healthcare professionals across the country. We're proud to be a part of this collaborative effort and stand here with our colleagues. Thank you.
Good morning. My name is Nicole Hayes, and I serve as Director of State Public Policy with the Christian Medical and Dental Associations, one of the co-signing organizations in support of this wonderful declaration. As the Christian Medical and Dental Associations, we affirm the biblical and biological understanding of humankind as having been created and distinctly made, and male and female. We are pleased to sign on to the Doctors Protecting Children Declaration as ethical healthcare professionals and others who are committed to providing and ensuring compassionate, evidence-based care, which is central to how we care for our patients. Medical decision-making should respect biological reality and the dignity of the person by compassionately addressing the whole person. Anything less is disastrous for patients and for the healthcare profession and will not promote human flourishing. We urge the practice of evidence-based care for children and adolescents struggling with gender dysphoria. This does not require courage, inasmuch as it only requires acknowledging truth and a desire to help and not harm. Thank you. Louis.
Great to be with you all. My name is Louis Brown. I'm an attorney and serve as a board member and vice president of public policy for the Catholic Healthcare Leadership Alliance. The Catholic Healthcare Leadership Alliance is pleased to support the Doctors Protecting Children Declaration because every child deserves ethical medical care that protects each child's life, health, and human dignity. Medical and scientific research clearly demonstrate that so-called gender-affirming procedures are seriously harmful to a child's physical, mental, and emotional health and well-being. Children dealing with gender confusion or gender dysphoria are owed love, compassion, and medical care based on the truth and goodness of their humanity and body, mind, and soul. To protect the health and dignity of millions of children, medical associations, healthcare professionals, healthcare entities, and government healthcare programs at the state and federal level must stop promoting and providing unethical and harmful so-called gender-affirming procedures. To advance a civilization of love and justice, our American healthcare system is ethically obligated to provide children with medical care that is healing, medically and scientifically credible, and that leads to true human flourishing. Justice demands that our nation's healthcare system provide care that upholds the beauty and truth of every child's dignity and true identity. Thank you.
Thank you, all of you. Thank you. It's an honor to stand here representing this coalition. And as you've heard, we've spoken loud and clear that we are going to protect children. And our colleagues are supporting us. And we urge you to read the declaration, urge the medical organizations of the United States to read this declaration and to stop these harmful procedures. We do have some time to entertain a few questions, if there are any.
Hi, my name is Josiah Sullivan. I'm here with Meg Killigan and representing Family Research Council. My question for you today, as physicians, as doctors, in a time where there's so much misinformation out there, What was the catalyst that made you want to stand up for children?
It's a very good question because all of us up here have been sounding this alarm for years and meeting resistance and being pushed to the side. All of us, I think I can speak for all of us, were a bit surprised when in the last few months, with the release of the WPATH files, the release of the final report from the CAS review, that just very clearly laid out the evidence that these procedures are harmful and not helpful in what's truly going on. I think all of us hope that our colleagues, those who maybe aren't paying attention to this discussion, would take notice and speak up. We also hope that the organizations would themselves put a stop to this, and they have not. In fact, they've doubled down and said that they're going to continue with what they're doing. So that to us was what mobilized us to want to take action and say enough, because we are numerous and we are leaders in healthcare, and if not us, then who? And we are here to do our job, to take care of children and protect them. Well, thank you very much, all of you, and those of you listening to us online. We thank you, and the Coalition of Doctors Protecting Children thanks you. Please check out the website and sign the declaration. Thank you.